I'm Hala Mohideen. Good evening. It's been dubbed a national tragedy and the Scottish Government is under increasing pressure to act. Official figures released this morning revealed that drug deaths in the country have reached a record high, with people in their 20s and 30s increasingly at risk. Now, in 2016, there were 867 deaths, up 23% from the previous year, and double those of a decade ago. Adding some context, however, makes the scale of the problem even starker, with Scotland's death rate per head of population 2.5 times that of the UK as a whole. And with opiates, including heroin and morphine, remaining the biggest killers, it's also the highest reported rate of any EU country.
We need to make sure that we look and see what works, be guided by public health evidence and analysis, working out where we can actually save money as well. A lot of people will be, unfortunately, presenting at accident emergencies as well, which has an impact on our NHS. So we need to work holistically across professional boundaries, across disciplines, working out how we seek out people who require that specialist help because of their complex lives, how we help them out and how we treat them.
The key thing that we need to do is to actually make sure we're retaining larger numbers of people with drug problems long-term in treatment. At the moment, it's potentially 50% of that 61,500 or less. We need to get that number up to 70 or 80%. All the evidence shows that if people are in treatment, they're much more protected against fatal overdose. So that's the key thing that we need to do to make an impact on the problem long-term.
Well, STV's David Cowan has met with some of those directly affected by what many now say is a drug death epidemic.
Last Tuesday should have been a milestone in Lee Kelly's life. His family held a party to celebrate at his graveside in Glasgow.
It was emotional, but it had to be done. It was his 21st birthday. We had to do something.
Lee was among the first of 867 Scots killed by drugs in 2016. Was he somebody who'd used drugs for a long time? Was he a regular user of drugs?
Oh no, definitely not. Lee was at college, Langside College. He was business studies. He was in his last year. He had a job coming out at the end of it, but he took a MDMA tablet. He died 3 days later, 3rd of January.
That tablet also contained rat poison and ketamine.
There should be more education put in. And they're playing with their lives. It's Russian roulette. It can happen to anybody. It happened to my Lee, and that wasn't him. He wasn't a boy that took drugs, and he knew the consequences.
More than half of last year's deaths were among people aged over 35, the so-called train-spotting generation, but 241 were under 35. Opiates like heroin were involved in 9 out of 10 deaths, methadone in 42%. The authorities have been using the same definition for a drugs-related death since the 1990s. Back then, the annual death toll was around 250. 2 decades on, it's nearly quadrupled, and it's showing no signs of slowing down.
The launch is the 25th of August.
Drug addiction and deaths affect thousands of Scots, and Kilmarnock, a new family support group, is replacing another local organisation, which closed after its lottery funding was cut.
You're just waiting for that telephone call to tell you they're dead.
Neil Sanders has been in recovery for 3 years and regards himself as lucky to be alive. He admits he sold heroin to fund his habit. He accepts that some of his customers may have died.
Quite possibly, yeah. You know what I mean? Obviously, I've got to take that responsibility that it could have been somebody involved in a death in something that I sold them. Ultimately, you don't know. You don't particularly care. Like I say, it's just about the money, because then that money gives you the drug.
He cares now. At 59, after a lifetime of drug abuse, he says early treatment for younger addicts is vital.
To me, that's your target area that you need to get. If you can get people into recovery in their early 20s, then people don't end up like me with decades-long addictions.
This was Jackie Reid, hooked on heroin, suicidal, ostracised from her family. And here she is now, clean for 8 years, thanks to a rehab course run by Christians.
Somebody that's stuck in addiction with drugs, they already feel like they're lower than the low of the marginalised in society. And it's remembering that nobody is exempt from drug addiction or alcohol. It can happen to absolutely anybody at any point in their life.
Again and again, people mention stigma, loneliness and isolation. Chloe Noble's mother and brother are addicts.
It is a constant worry. It's always in the back of my head that late at night and things, and I'm in bed. That's mainly when it's hard. So it is. It kind of keeps you up at night. As everyone knows, everyone has their problems. Everyone has struggles. Just sometimes people can't deal with it as good as other people, and people turn to different things. But I don't feel like it's going to move forward if just look down on people rather than trying to help.
So what can be done to help? One of the women setting up the Kilmarnock group has lost to drugs a cousin, 2 nieces and a nephew.
These are lives, these are people's daughters, sons, husbands. It's just getting worse and worse, and families are not getting enough support because a lot of these deaths could be prevented with family support.
Douglas Bald will be one of this year's statistics. His mother says rules on confidentiality and data protection stopped her finding out the severity of his drug use until it was too late. He overdosed in Cumbernauld in February, aged 42.
I said to Douglas at one point, I said, just don't take it. This was shortly before he died. I said, just don't take it. And he said, it's the only thing that puts away the pain. I am consumed with feelings of guilt because I knew that he was down. I knew that he was as down as I'd ever seen him, and I didn't know what to do. There needs to be help for the carers.
The group, Scottish Families Affected by Drugs and Alcohol, says the death toll would be even higher if relatives were not doing everything they can to keep their loved ones alive. But unless the trend is reversed, overdoses will kill more than 1,000 people in Scotland this year. David Cowan, STV News.
Good evening. Scotland's drug death rate has risen to record levels and is around 2.5 times that of the UK as a whole. Critics say it shows the Scottish Government's drugs policy isn't working. In 1997, there were 224 drugs deaths. A decade later, that had more than doubled. In 2015, the total had risen to more than 700. But now it's jumped by almost a quarter to 867. Our Home Affairs correspondent, Reva Alderson, has been studying the figures and meeting some of the people affected.
Graham had just been released from prison the day before when he got out, overdosed the following day.
Graham Bigley's death from a drugs overdose left 2 young children without a father. That's the effect a drugs death has on a family. There have been 4 drugs deaths in Julie Bigley's family in recent years. With a friend, she's now set up a service in Kilmarnock to provide support to others affected.
These are people. These are people's family, daughters, sons. They're families. But the families can't cope. They can't cope themselves.
It's a horrible thing. And I know a lot of friends that have died this year and last year.
Particularly at risk are older drug users. Almost 3/4 of those who died were aged 35 or over, addicted for longest, already failed in treatment, and now feeling services have run out of options.
I was to be put on a high level of methadone and to basically be left to my own devices. I didn't think I was going to be able to get clean.
It's just a case of, oh, you're still using, no places for you, no funding, no money, put your meth up.
We're looking at the psychological needs and the client's physical health condition as well.
Drugs workers say they're struggling with government funding cuts. Here in North Edinburgh, that means not being able to take drugs and continue to take them.
Unless you're dealing with the underlying elements, whether it be a mental health condition, a physical health condition, past abuse, and finding a way for the client to develop healthier coping strategies, they're very unlikely to give up the coping strategy that they've become accustomed to.
At a time when drug deaths are at record highs, we've seen services significantly affected by these cuts in funding, which have definitely reduced access to services at a time when we needed to improve access to this group of older drug users.
Drug addiction costs more than the rising death toll. Homelessness, crime and antisocial behaviour, as well as the impact on the NHS. Drug users cost around £100 million a year in emergency hospital admissions. The government's spent £600 million over 10 years on drug treatment, but it's now preparing to revamp its strategy called the Road to Recovery.
There's a lot that we can be proud of from the Road to Recovery, the impact that it has had right across the country, but that will be 10 years old next year. And so we need to take cognizance of the changing landscape of the way that services are delivered. We also need to take notice of the changing way in which people are taking drugs and the different drugs that are out there. So it's right that we refresh this.
But with Scottish drug death rates the highest in the EU, there are fears the situation won't improve soon.
It's just going to keep going up. It's just going to keep going up and keep going up and keep going up. There's no stopping it.
Reva Alderson reporting Scotland.
The Scottish Government's drug strategy is coming under attack from health workers after figures showed a 20% hike in the number of drug deaths in Scotland last year compared to the previous 12 months. 867 people died as a result of fatal overdoses. Professionals who work with users say budget cuts have had an impact on services. The Health Minister says there's a UK and Europe-wide trend of older people dying from drug misuse.
Now we're going to talk about drugs deaths at the moment. After one, we'll hear from Brendan Foster. He's going to look back on his career and think of some of the great highlights and some of the great Scottish athletes he's commentated on. Also, he'll talk about whether he's still running. So Brendan Foster still to come after one. But let's have a look at this. 867 people died from drug overdoses last year, according to the latest figures. That's in Scotland. That's up more than 20% on last year's record number of 706.
The majority of deaths were among people aged 35 or over. Critics say that the figures call into question the effectiveness of the Scottish Government's drugs strategy.
We'll find out whether this is more or less than the rest of the UK in a minute, but our reporter Andrew Anderson's been speaking to the Public Health Minister, Aileen Campbell.
The Scottish Cabinet's meeting in Montrose today. I'm joined now by Aileen Campbell, the Public Health Minister. Ms Campbell, 867 drug deaths in Scotland in 2016. That's a shocking statistic, isn't it?
Well, first of all, let me put on record the absolute tragedy that this represents and the heartbreak that we know a lot of families will be going through, and send out our deepest sympathies to those families that have had their lives impacted by this drugs death figure. It is important also to put it into context that this is an ageing cohort, and this is being experienced by not just Scotland but across the rest of the UK and across the rest of Europe. But it's certainly something that I'm very determined that we look at and that we tackle effectively here in Scotland.
Well, it's up 20%. The number of drug deaths in Scotland doubled between 1997 and 2007. If this continues, it'll double again in the next decade.
Well, there is an ageing cohort of people coming through that have been using drugs for a number of years and have a number of the medical and health problems associated with those complex lives, those complicated and chaotic lives as well that goes with having a substance abuse issue. So we have to effectively tackle it. That is why I announced last month my intention to refresh our drug strategy, to make sure that we're looking at this through a public health lens, but also to tackle head-on the issue that we have in Scotland around this ageing cohort of drug users that are going through our systems, and that's where my attention will be firmly focused.
Well, you've had a strategy in place since 2008, the so-called Road to Recovery. It's not working.
There is an awful lot that has been achieved by the Road to Recovery. We have fewer young people taking drugs. The relative number of adults taking drugs is falling, and we are meeting our national referral targets. So there's a lot that we can be proud of from the Road to Recovery, the impact that it has had right across the country, but that will be 10 years old next year. And so we need to take cognizance of the changing landscape of the way that services are delivered. We also need to take notice of the changing way in which people are taking drugs and the different drugs that are out there. So it's right that we refresh this, but also that we have a focus on this ageing cohort that are going through systems at this point in time. And that's why with the Scottish Drug Forum, we'll be seeking these people out, treating them and keeping them in services.
And will the money be there? Because those who work with drug addicts say they've seen a 23% cut in funding from the Scottish Government, money that was supposed to be replaced by the health service, but which hasn't come through.
Well, we have invested over £600 million since 2007 in alcohol drug partnerships. partnerships. We've invested heavily. We're seeing fewer youngsters taking drugs, and that's been backed up with the investment that we've taken over this last decade.
But has there been a 23% cut?
Well, what we also expected was the NHS boards to make up and contribute to effective drug treatments in their area, and the outturns will come out later in the year. But certainly we have invested heavily in ensuring that we can support people with addiction problems, and have invested over 600 million since 2007 to do so. But we understand that the need to refresh our approach, and that's why I announced my intention last month to do so.
Do you expect to be standing, if not here, then somewhere this time next year, and seeing another increase in drug deaths?
Well, I think it's also, again, important to recognise that this is a trajectory that's not just been felt in Scotland. It's been felt across the rest of the UK and in other parts of the world as well. And it's a trajectory that started over 20 years ago as well. And that's because there is this ageing cohort coming through with the different challenges, life challenges, social challenges, health challenges now that are presenting through decades of substance misuse. So what we have to do, and what I intend to do through our refreshed drug strategy, is to seek these people out, give them the help that they require, and keep them in services. Because if we can keep them in services, then we stand a far better chance of ensuring that they don't go on to be an unfortunate statistic in years to come. So that's what my intention is we seek people out, help them, and keep them in services to try and avoid some of this unnecessary damage happening for far too many families.
Okay, Aileen Campbell, Public Health Minister, thank you very much indeed.
Well, that's the Public Health Minister. But before I move on, I just want to speak to Kirsten Horsburgh from the Scottish Drugs Forum in the studio here. Now, she quite clearly said that our rate of deaths is increasing, as is the rest of the UK. But can you just quantify the rate, compare us with the rest of the UK?
Sure, of course, and thanks for having me. Firstly, thoughts out to everyone who's affected by the terrible and tragic news that's come out today. So rates of drug-related deaths in Scotland are very high, and when you look at us in comparison with the UK as a whole, we're 2.5 times higher, and certainly in comparisons with Europe, even though there are differences in how those statistics are gathered, certainly we are top of the table when it comes to drug-related deaths.
Okay, well, I didn't know that until you told me this. So at the moment, what you're telling me on air, we're going to hear from Stuart, who was a drug addict, started taking 20 years ago. We've got the biggest rate of increase in Europe and one of the biggest problems in Europe, and certainly worse than the UK.
We have similar increases in the similar rates increase-wise, but definitely higher numbers.
Okay, well, let's speak to... Well, we heard from Stuart earlier on. I interviewed him. He's now 40, and he first started taking drugs when he was just 21.
Well, I started taking Valium at first, and then I was introduced to heroin by one of my friends, and I started to like it.
What was it about heroin that you liked?
It was just, I was going through quite a lot of things with the girl I was going at the time and whatever else, It was sort of just like helped me to block out all the problems that I had,
And how often would you take heroin at the time?
How often? I would probably say I was taking maybe 30 or 40 pounds worth per day, when I first got addicted to it.
How many injections is 30 to 40 pounds worth?
Probably 4 or 5 a day.
That's a lot of money to find. I mean, how would you fund that kind of habit?
Well, actually borrowing money off friends, family, actually dabbling in selling drugs, as well.
And tell me then how you then get into a methadone program, or got into a methadone program when you're in the middle of that mayhem of injecting heroin.
Well, I think you get to the stage, you get sick or tired, of like getting up every day. Every day becomes like Groundhog Day, You look back and you see what you've lost, and something a penny just drops inside you, It's like, I want to try and get off it, because you remember your life before drugs, was better than what it was on drugs, no having anything, no being able to do it, and people just looking at you, like you're a leopard, sort of thing, and it's like, and I got on methadone.
What was methadone like? What does that do? And did that stop you taking heroin at the time?
It didn't stop me taking heroin straight away. I was using heroin on top of it. And it actually took me longer to get off heroin than it did actually to get off heroin.
Say that again. It took you longer to get off?
It took me longer to get off methadone, actually, when I was on heroin.
Why is methadone so hard to get off?
Well, don't know if it's just down to like some of the workers or some of the support you get. They also always say that you're not stable enough either to come down on it or to be weaned off it.
What is it like when you go into that wee cubicle to get the methadone?
Well, it was at the time I was taking my methadone. It was in the cubicle. You know what I mean? You had to sort of like go into the chemist and you'd be standing in the front of the queue. You know what I mean? People would know your mum and your gran or whatever else, and they would just like hand a cup over the counter to you. You know what I mean? And maybe like school children in and all that, and everybody knew what you were in for.
I know you've got a good line about how you describe methadone.
Right.
Tell people that you don't think it's that effective.
I don't think it's that effective. I think it's actually, you know what I mean, like an elastoplast for a bullet. You know what I mean? Eventually, you know what I mean, things are going to seep out and people start to use drugs again. You know what I mean? And it's like, I don't think it's the answer. You know what I mean? I think you should actually be looking at the root causes why people start to take drugs in the first place. You know what I mean? Like their upbringing, you know what I mean? Things that are happening in their life.
Stuart, you're 40, and age 40, most people, well, a lot of people have maybe the same again left. But did you know people who died taking drugs?
I've lost a few friends, you know what I mean? A few people, you know what I mean, taking heroin as well. Aye.
What happens to them? Because we'll talk about you in a minute. But what happens to these people who get involved in heroin and get sick and they die? But to many people they're a statistic. But they're your friends. What happens?
Yeah, well, I'll just a number on a page to people. You know what I mean? Hang me. But people, you know what I mean? They die and they're forgotten about. You know what I mean? Hang me. It's like I've been in people's houses. You know what I mean? And people have took ODs and they just took out the back of their coats and left. It's terrible.
And I'm assuming that if you inject and if you don't eat properly to fund it, and you maybe also take other drugs, you may be also taking cocaine and various things, that there'll be infections all the time, and it'll be a pretty sick life.
Yeah, it's not. It's like, no, I mean, your one drive is like you're saying, not eating, whatever else. All your money actually just goes into one thing. You know what I mean? You're almost focused on getting drugs to see you through the day, and your health, and that. You don't really care how you looking. You know what I mean? And how you are inside yourself. You know what I mean?
Have you stopped completely?
Yep.
How did that happen?
It's just, you know what I mean, hang me. Well, I was saying, being sick and tired of my life, you know what I mean, looking back and seeing what I had lost through my life, and being around about people, you know what I mean, having like proper counselling, you know what I mean, and people understanding, you know what I mean, getting to the root of the problem why I was taking the drugs.
And do you feel healthy, and do you kind of think, well, if I was still taking drugs, I could have been a death statistic too?
Yeah, I feel healthy in myself. I feel a lot better. You know what I mean? I'm more happy with myself. You know what I mean? I've got a better outlook in the future. You know what I mean? Instead of like getting up every day and like chasing money for heroin.
Well, that was Stuart talking to him earlier on. So 867 people died from drug overdoses in Scotland last year. That's latest figures, up more than 20% on last year's number, which was a record of 706. And we see them everywhere. Well, obviously people are dying of alcohol and cigarettes too, but we see them everywhere. We've got addicts in most towns, I would think, and people are dying. Join me now, David Rains from the National Drug Prevention Alliance, the retired GP Dr. Robert Lefevre, who's an addiction specialist and author of a book called Kick Your Habit. And we heard earlier on from Kirsten Horsburgh from the Scottish Drugs Forum. Let me go around all three of you first of all. Kirsten, do you think we're going about it the right way in this country?
I think there are fundamental changes required in the way that we approach certainly overdose prevention. There are two different strands to it for me. So there are what we can do to prevent the overdose actually happening and what we can do to prevent an overdose becoming fatal. So I work on a project, the Naloxone programme in Scotland, that provides people with a medication that can reverse the effects of opiate overdose, and the overwhelming majority of these deaths involved opiates. So we can do one thing as to preventing a fatal overdose by encouraging people to access naloxone, making sure that they have it available. But on the other end of things, before the overdose actually happens, there are huge changes that need to be made, and it's particularly around the engagement and retention of people in drug treatment services. We know that opiate replacement therapy is a protective factor against death, so that is definitely one of the main things we need to be doing. Quick access to treatment, so we've gone from a horrific situation where people were often waiting 18 months, several years back, to even get an appointment in a drug treatment service, to now a 3-week waiting time, which is obviously a lot better, but still not adequate. People should be getting access to treatment on the day that they present. to treatment services.
Dr. Robert Lefevre, I thought that the Public Health Minister said that this is an ageing cohort. So in my head I had, well, they're dying because they're older, they're getting infections, they're unhealthy. And we know from the numbers in front of me here in Glasgow, there are almost as many methadone deaths as there are heroin deaths.
That's absolutely right. Methadone is not a treatment for heroin addiction. It's like changing gin for whiskey. It's a major drug, and it causes a lot of damage. I'm not in favour of harm minimisation or drug substitution as a general principle. I like abstinence. That's what works. And being able to be abstinent and feel content with that, not to go up the wall. May I mention straight away, Castle Craig Rehab in Peebles is the best rehab, in my view, in the whole UK. You've got wonderful people there. Peter and
It's private, isn't it? Is it private?
Yeah,
well, who pays then?
They see people on the NHS.
Right.
They've done wonderful work, and they're continuing to do that. And so I wanted to have a message of hope here. In my own rehab, I've looked after over 1,500 drug addicts, a total of 5,000 addicts of one kind or another altogether. And we followed the abstinent principle of Narcotics Anonymous, and that works very well. We had a 60% long-term recovery rate, which for a chronic illness which has such an enormous mortality rate, that is a very encouraging factor that we can help people to live the life they want to live, rather than to be the idiots that they were born to be.
Okay, but before I move away from you, do you think we're getting it right as a country?
No, I think we need more 12-step treatment centres like Castle Craig. That's where the future is.
All right, before I go to David Rains, Kirsten Horsburgh, do you agree with that?
No, I think we need to be realistic that one-size-all approach does not fit. So whilst abstinence-based services are absolutely crucial, of course they are, we also need a whole range of different services. We need to be realistic that there will be certain people who in their current circumstances are not ready for abstinence, so we need to provide people with services to meet their needs where they're at.
Okay, David Rains, do you think we're going about it the right way as a country?
I think Scotland's in crisis with its drugs policy, and I was very interested in what Dr. Lefebvre said. I mean, I know Castle Craig as well, and I agree with him about that. The shocking thing about these statistics, and there's a lot of data for us all to analyse, the really shocking thing is there's 112 alcohol deaths. Taking those out, with of the rest, roughly half of them, there is a mention of methadone, which is a medication provided by the state.
Yeah, but hang on, these numbers are quite interesting because that's being co-used with lots of other drugs. Now we have to accept that some people who die are using. Now, of the 867 people who died, 362 were at some point taking methadone as well.
Well, yeah, there's a trace of methadone in their body. I agree. I absolutely agree with you. I think the message for Scotland, and I love Scotland, and my ancestors were Scottish, and I go to Scotland a lot. The message for Scotland is you've got this train-spotting generation that Kirsty's talked about, and you've got them dying. The big issue is, are you going to have another train-spotting generation? So I think that we've really got to get into preventing young people starting taking drugs.
Well, the health minister said fewer young people in Scotland are taking drugs now. So
yes,
this is the older generation who started in the 90s, and they're dying because they're older.
Yes, in fact, Scotland's heroin opiate problem goes back to the 70s, and I used to be in law enforcement, and I worked on it then. It does go back a long way, but keeping young people away from drugs and changing the culture around drugs. And of course, in the UK, we battle against the legalisation lobbyists who want drugs legalised. And it's a constant battle. I've been on your programmes before talking about that. So that's the first thing. And then, as Kirsty said, we've got to retain addicts in treatment. And like Dr. Lefebvre, I don't believe that methadone, what is called parking people on methadone for up to 10, 12 years, I don't believe that is treatment. It's just substituting one drug with another drug, which is heavily addictive. And I thought what Stuart, your ex-addict, had to say was very, very telling. You know, it's very telling. He said people use methadone and use something else.
Kirsten, it is part of our current strategy, isn't it?
Yeah, I mean, I just want to address the thing about methadone here. So methadone is a protective factor against overdose when you're on a therapeutic level of it. The efficacy of methadone is not being argued here. It's well evidence-based for many years. What I would say about methadone being implicated or causal in some of those deaths is that in about 6 months' time, when we receive the drug death database report that gives us a more individual look at the circumstances surrounding the deaths, we'll see that the majority of those people were not prescribed that methadone, so it's diverted methadone, or for those who were prescribed methadone, they weren't on a high enough dose to meet their needs. So I think to vilify methadone is wrong. I think for lots of people it absolutely saves lives. And certainly there are
important points. The prescribed methadone is one way of getting it. Another is spit methadone. These are people who are prescribed methadone will then spit it out into a bottle and they'll sell that spit to people whose major drug is methadone rather than heroin. But the big issue did a major survey on people who were taking methadone, and they found that 50% of them were also taking regular heroin. So it isn't a substitute. As we both agree just now, it's like gin and whiskey.
Let me go through these numbers for you, for everyone listening in Scotland. All drug-related deaths, 867. Of them, 473 tested for morphine, 362 tested for methadone, 43 tested for cocaine. Dihydrocodone was 114. So there's a cocktail of drugs involved. Do we think that fixed rooms? So do we think, Dr. Robert Lefevre, that fixed rooms are a good idea, where you can go and you can have safe use of needles and gather together with fellow addicts to safely inject the stuff?
No, I don't. I think that's simply a policy of despair.
Okay, well, all right, you don't agree, Kirsten. Do you think fixed rooms are a good idea?
I absolutely do, and I'm actually a member of the Short Life Working Group in Glasgow who's putting forward that proposal to introduce it.
All right, Dr. Robert, what's wrong with it?
It doesn't work. It simply enables the illness to continue. What we need is hope. We need a sense of life, a sense of beauty, of honour, of innocence.
All right, we're running out of time. David Rains, do you think that fixed rooms are a good idea? David Rains?
I certainly don't, and I think the experience of Vancouver shows that they're very bad. I think injecting behaviour is something we've got to try and stop. We've got to try and prevent injecting behaviour because of all the other dangers that come with injecting. So I'm with the doctor, I'm afraid, on this. I think the battle in Glasgow to have a drop-in centre for injectors is supported by a lot of drug legalisers. I'm not with them at all. It just perpetuates very, very damaging behaviours.
Kirsten, we've got, this is the usual stuff. We've got one lot saying the evidence shows this, and you'll be saying, no, the evidence is good. So what's the evidence?
I think we need to be very clear about whether we're talking about views and opinions or evidence, and the evidence base is very, very strong for supervised injection facilities. They've been around for over 30 years. There's more than 90 across the whole world, and they have all positive outcomes for the services they provide.
Is there an issue with the older addicts? But I mean, you were talking about preventing people overdosing. I would have thought the older addicts were more used to injecting and therefore knew the doses. And the health minister was saying it's more the older addicts that are at risk. Who's dying here? Who are the people dying?
Yeah, I think sometimes when we talk about older people who use drugs, it can be quite misleading because we're talking about people aged 35 plus, which is by no matter means old. But when you've potentially had a 15 to 20 year history of problematic drug use, it's that accumulative effect that's causing multiple health problems, lots of physical health problems, mental health issues, and social factors, increasing the risk for particular groups of people.
I completely agree with that. These people are not old. They're older than they were when they started using drugs. But they're getting the damage, the cumulative damage, and that's destroying them. And this is a tragedy. And this is what we must look at, is to help people to have the lives they deserve.
We've got a couple of minutes left. Dr. Robert, I cut you off earlier. I'm very sorry. Just look ahead for me. Now, you think we need more spend on centres that we can send people to, like you mentioned Castle Craig.
Yes.
What else do you think that the country should be doing?
I think we need to look at prescription drug addiction in the broad sense, not just at methadone addiction. We need to look at tranquilizers, sleeping tablets, antidepressants, painkillers. You know, addiction is addiction, regardless of what it's to. And an addict is an addict, regardless of what he's using or she's using at this present time.
All right, David Rains, what do you think we need to do?
Well, I think preventing young people starting taking drugs, as I said at the beginning, I think injecting is a very dangerous behaviour and we ought to start.
Yep.
It might just be worth ending on note how many ecstasy-type drugs cause deaths. There's 28 of those listed on the statistics. There's 123 cocaine deaths, and we've been getting cocaine deaths in England as well because cocaine is stronger. People have been demanding a stronger hit, and it's been causing heart attacks, more or less instant deaths. So There's a lot to do. There's a lot to do, and there is no simple answer. I don't support the injecting rooms in Glasgow. I think that's nonsense. But there we go.
Okay, David Rains, my apologies. I didn't come to you as much as I should have. Thank you, Dr. Robert Lefevre. Last word to you, Kirsten.
Certainly just going over everything that we've talked about before, so we need better services. We haven't mentioned stigma at all, and I think that's a really key point as well. There certainly needs to be a huge culture shift in our services that we provide to people, and punitive services need to be non-existent.
Okay, thank you very much, Lee. That's Kirsten Horsburgh and David Rains and Dr. Robert Lefevre. What do you think? 80295 the text. It's 1 o'clock.